Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown, and I'm here with the great Todd Fleischman again. We're doing a multi-part series like we've been talking about the last couple episodes. Today's subject is really important. We're talking about the hygienist-dentist relationship. And I feel like there's so many points of view on this. How does the hygienist feel about the relationship? How does the dentist feel about the relationship? How does the staff see the relationship? And what does the patient think? Because really in a practice, there's two providers, and two providers see the same population of patients. And the question always comes up, whose patients are they? Whose patients should they be? Is it who deals with them more? It's such a big thing to unpack. And hygiene today in the United States is such a sensitive subject, with reimbursement rates being too low, cost of hygienists being too high, and it being impossible to keep a hygienist, and dentists being paranoid that patients are going to follow hygienists if they leave. So this is such a gigantic thing to unpack, and it's such an important subject. Todd, where do we start with hygienist patient or hygienist doc relationship?
Yeah, build them. That's where you start, right? Like build that relationship. I'm in love with my hygiene team. I mean, again, we have to put this in the correct context. We're unfiltered. We pride ourselves on that in your podcast. And like, I'm very candid. I run a fee for service practice. It does afford us different opportunities with the hygienist than I would think an insurance driven practice does. And that does give me more flexibility to invest in my hygienist differently than an insurance driven practice does. That's not a fault of an insurance driven practice. It's not to say it's not as good as a fee for service office. None of that is true, right? I know people that have beautiful cleanings in insurance driven practices, but realistically, it's just harder to compensate hygienists at a certain level when you're getting reimbursed, $46 an hour for the total time that you're spending with them, when a hygienist is getting paid $55 an hour. And I do think it was time to reframe the hygiene model a little bit post-COVID. I mean, I think that dentists got away with murder for a very long time with these professional positions, and I do think we need to hold them in a different regard. I like to empower hygiene, personally. I'm a huge hygiene guy. Like, fee-for-service hygiene model is a lucrative model. It's a wellness model. It's a model that manages chronic conditions. You can really reframe narratives for patients when you're doing it on a fee-for-service level and you're not insurance-driven with the timing and certain limitations that insurance gives you. So you really cannot compare, unfortunately, my approach or a fee-for-service hygiene approach typically to an insurance-driven approach. That being said, I do think you can still make a choice to empower your hygienists to be wellness professionals, right? To build their own books, to take responsibility for their schedules, to have ownership of the practice, right? I really, when I hired my hygiene team, and by the way, during COVID, even in an experienced practice like mine, in a beautiful setting, in a fee-for-service model, I had a full hygiene turnover during COVID, 4 hygienists.
You lost all 4.
All of them. Not at the same time, but within 3 years.
It's still scary.
Especially when, like you said, to introduce the concept that we're talking about, the relationships that patients build in the office are typically the strongest with the hygienist, right? It's the person that sees them the most. It's the person that can impact their health, which is what we should be focusing on, the most, right? And when that person leaves your practice, there is that anxiety to say, oh, geez, is the patient going to find out where that relationship went and take their business to that other practice? The short answer is not typically, right? Because it does take a lot for a patient to leave your practice. And even though we think in our heads that the relationship is with the hygienist, which it certainly is, it is still with the doctor too. And most people won't leave an office if that relationship with the doctor is at least stable on some level.
I actually am a legitimate high anxiety dental patient. Like I am. When I get my cleaning, I need gas, I need my handheld, I need the x-ray bib in my chest. I am that guy.
The military guys, the ones who have jumped out of planes, searched for bin Laden, and here you are in the chair, with the first time you're sweating is with the Cavitron buzzing.
Yeah, and I haven't searched for bin Laden, but my buddy said, but you're right, we're all scared of the dentist. So I see from my point of view, the hygienist, the person I interact with, and it's a great relationship, I interact with them the most, but I see the dentist as like the director and coordinator of my overall care.
That's legit.
No, that's how I see them from my point of view. Like, I like the hygienist. Hygienists come and go. I miss my old hygienist, but I still have my doc. My doc is like my foundational piece that I latch on to. I actually don't latch on. I personally do not latch on to the hygienist.
There's such a wide range of normal. This is humanity, right? So you're going to have some people who really want to be driven to their hygienist, and you have some people who are driven by their doctor motivation. I think you have to play the percentages. At the end of the day, we're not going to please everybody. And dentists really have to come to that conclusion. You got to, again, give yourself some grace. This is something that I'd say a lot to both my patients, to my team, to my family, to myself, because you can't be everything to everyone all the time. It's unfair, right? But you can certainly try to be as much as you can to someone all the time. And that can include the hygienist's relationship with the patient, the hygienist's relationship with the doctor's relationship with the patient. And when it's hitting in its most symbiotic way, that's when patients feel incredibly taken care of. And that should be the ultimate goal for a hygiene relationship. Because again, and I'll keep preaching, and this is verbal skill stuff, hygiene is a wellness model. And I am at my biggest, my goal now within the community is to have dentists reframe how we do things. We're not the drill and fill model anymore, right? We're just not, it's not going to be sustaining. What we are is a wellness model. We manage chronic conditions. Periodontal is a chronic condition. Airway is a chronic condition. Cavities for some people can be an absolute chronic condition based on a genetic predisposition. So we are a manager of chronic conditions, and most patients see their dentist considerably more than their primary care physicians. So we are on the front line. It's our responsibility to look at people's mouths, and that usually starts with the hygienist, and say, what do things look like and how can we make these patients healthier? If you can give that empowerment to your hygienist and have them understand that you're not just here to clean teeth, that if you're interested in more, I can offer you that opportunity. It reframes the narrative, both for the patient and for your clinician, and it elevates the experience significantly, right? Which is what I'm looking to do with my hygienists and patients.
You know, earlier you said about the hygienist impacting the patient's health more than the dentist does. I think some dentists don't own that or believe that.
I don't disagree. They want to be everything to everyone.
They think they're the pinnacle, right? And I think they are. Like, I think there's a point though where like you have to kind of give credit where credit's due, but also like kind of raising the hygienist up. I think there's like this kind of like pre-canned placement of positions in the practice, and it's like dental assistants down here. Hygienist is like big dental assistant, a little bit above dental assistant, but then dentist is way up here. And I think it's more like dental assistant here, you're important, you augment the effectiveness of the dentist. But I think a hygienist isn't as far below of the dentist as far as the patient's needs go as the dentist really doesn't want to give them credit for. Like, they're actually right there. I think when you say lifting them up, like, make them realize that they're more than just a hygienist in the typical thinking of a hygienist in your practice. You're another clinician in this practice. You're a professional. I think hygienists get put on the shelf that is like support staff. I think the support staff is the front, and the DAs and the clinicians are the doc and the hygienists.
Well, right. You have producers, saying that, right? You have producers,
yeah,
and then you don't.
I think
right?
the mindset changes things.
Mm-hmm. I don't disagree. I also think you have to lead with humility and modesty, right? I mean, that's a big part of what we do. Like, to give them the credit that they deserve for the work that they're doing, which, as an aside, is incredibly backbreaking. And we know hygienists don't have long-term careers, right? And so it's incredibly challenging, and you can put systems into your practice to make it easier for them, put the right equipment in place, put the right chairs in place, give them loops, give them things that they need to work at a high level, just like dentists try and do, right? You know, I think that dentists need to be less myopic in their approach, understanding that hygiene isn't just there to clean teeth to support the restorative model. I almost feel, and have guided my practice, and I've told this to my associates and to my team for many years, I'm trying to build a fee-for-service hygiene mill, right? Like, it's incredibly lucrative. You get recares that are self-perpetuating. Most of my patients are coming in every 3 or 4 months. It's only a handful of people that come in 6 months and still look super healthy. And if you educate patients about the need for additional cleanings a year,
you don't have PPOs dictating care. You can
First of all,
have a better care schedule.
You can still have PPOs dictating care, but you can also still offer patients better care. You can have an insurance-driven practice and still have patients pay out of pocket twice a year for 2 cleanings because you've educated them and you've reframed the narrative on why it's important to get your teeth cleaned, right? Because of all the comorbidities that come with it: cardiovascular disease, heart disease, stroke risk, hypertension, neurovascular changes, Parkinson's, Alzheimer, all sorts of things, right? That are evidence-driven comorbidities that come with the same bacteria that cause periodontal disease. Now, I tell patients very candidly, I'm not here to sell or educate, however you want to put it, through fear. I'm not interested in that, right? But if you think that I'm not going to talk to you about the potential for concerns because you're letting your mouth fall to nothing, is a mistake on my part. That means I'm not doing my job appropriately, right? And that's something that I think a lot of dentists need to pay attention to, is that where are you dropping the ball? Because when we get new patients into our practice, not only do they feel like the new patient experience is something they never had before, every time they sit up, they go, wow, I've never had an exam like that. And then in hygiene, they've never been approached with being seen more electively by choice because they've been educated that it will actually benefit them. They just never had the choice. Doctors go into their conversation with patients saying, I'll see you in 6 months, whether they look like crap or not, whether they come in bleeding or not, whether they see negative changes over time or not. This should be data-driven solutions, right? Do the periodontal evaluation every year, compare the numbers to each other, take the FMXs when appropriate, compare the data to each other, and educate your patient that you are worsening. If you are worsening anywhere else in your body, your blood pressure is going up, you are more at cardiovascular risk, you had a cardiac calcium score, and you had a high score, and you're at risk for the widowmaker, you would do something about it no matter how much it costs. Why are we hung out to dry as dentists? Why are we hung out to dry as dentists? Because we don't believe that what we do is as important as a medical model, which is a complete fallacy.
So when you were just saying this, I'm like a good 8 months overdue for my cleaning because how much I travel for dentistry. And I am. And my family is very prone to cardiovascular problems and risk, and we're big people. I'm a 240-pound UC man, pretty husky.
Airway plays a role in that too. We manage chronic conditions.
Yeah, and when you said it, it all hit me at home personally. And I think that dentists' mentalities sometimes devalue themselves. Sometimes they I say this all the time, like, your mouth is the gateway to all your health. You just said something that I had a personal epiphany. The plaque that's in your mouth becomes the plaque that's in your arteries.
Same bacteria are implicated. I'm not making it up.
Yeah, and it's like, but why do we devalue dental more than...
Because of the traditional experience. It's just because of the traditional experience. Because I use this line all the time. What we know now, right? It's okay to change your approach in the practice. It freaks patients out. It's true. But it's as simple as leading the conversation with, hey, Mrs. Smith, what we know now is that accepting your mouth bleeding every time you come in is not a benefit to you. And if you want me to just sit here and tell you look fine while you're coming and gushing in blood, where if you were, and everyone knows this line, right? If you were bleeding from anywhere else in your body like that, you would manage it immediately, right? But because you're bleeding from your mouth and it stops on its own because the mouth heals with different properties, you choose to ignore it.
100%.
Those conversations, they start with hygiene, but they lead with restorative, because at the end of the day, I also talk to patients about getting treatment done in a timely manner before they're too old to want to sit in the chair and make their mouths healthy again, right? Because it does take time. It does take effort. It does take an investment, right? And so it's about approaching patients timely with care, also being cognizant of that for them, helping them make choices earlier in their long-term dental careers so that they don't lose their teeth, so they don't lose function. So when they are 90 years old, they can still eat the food that they want to. They can still keep themselves healthy. They can still have the energy they need to sustain themselves. Because as long as you avoid the big C or some neurodegenerative cognitive disorder, we're going to be living long lives, right? And you want to be living long lives in a healthy way. You don't just want to be living a long life, but not being able to eat your food or walk around or leave your house. You want to live a long, healthy life. That is the takeaway message. And interestingly enough, perio and perio management can play a huge role in that. So empower your hygienists to be professionals and educate, but you have to educate your hygienist first, which we've done incredible trainings to do that.
We can say empowering your hygienist, right? We can say that just on a daily basis. What do you do to empower your hygienist and put them in that position to feel like they are an equal important provider in the practice, and that they're critical and that they're valued? Like what do you do on a daily basis? Like it's easy to say we empower them, but how does Todd Fleischman do that?
Comes through education, first and foremost. I mean, if you don't know what you don't know, then how can you have the conversations with patients, right? So it comes with education first, right? So we bring in consultants, I send them a continuing education, I invest in them a lot because these are major producers for the practice. And you can go deeper and deeper into it, but like at the end of the day, if they want to be compensated more, then they have to do more care. They have to build their book. They have to take responsibility for their column, right? And for their patients. And if they do that in the right way, their patients will want to come more often, present healthier, and be more successful with their outcomes, right? And so all of it's intertwined. So first and foremost, I educate them. Then I do exactly what you just did, and I remind them how important they are on a daily basis during our morning huddle, right? I remind them of the impact on health and wellness, that we are a wellness model, and that every time you touch their teeth with the piezo, with the Cavitron, with your hand scaler, with the guided biofilm stuff, you are making your patients healthier. We are in the service business. I remind them on a daily basis, and your service is to make your patients healthier. Tell them whatever you need to tell them to move them in that direction. Do not pull a punch. At the end of the day, they can make their own decisions. They are big people, our patients, right? We empower our patients also to make, they're adults, they make educated choices, right? But I always tell a new patient, we want to guide you toward idealized care first. Period. Hard stop. And then you will choose, Mrs. Smith, if that's the right model for you. We can still be friends. I joke. Paulie taught me this. We can still be friends even if you say no to me. And you can come in every 6 months and I'm happy to take care of you. But our message will not change. Your mouth is not healthy. You need periodontal therapy. These are examples, right? But we always stay on message. We have these all the time. We learned the systems through consultants, which we could talk about if we want to name specific people. It's up to you guys. But we learned.
Listen, if there is a consultant that you've had who's been very helpful in this realm,
I'll blow them up. I'll blow them up.
Seriously, yeah. That's the point of Unfiltered is don't hold back, Todd. There's no associations or affiliations with me.
They don't pay me. I paid them, right? But the JP Institute, JP Institute, based out of California, is a hygiene-driven continuing education philosophy for the doctors and hygienists, right? And it teaches you about periodontal therapy, periodontal evaluations, ways to approach your patients, diagnostic testing, all the models and the coding and everything involved with empowering your team for a wellness hygiene model, right? And maybe you can do it in insurance driven, or maybe you can't, and maybe you think you can afford it, or maybe you can't, but you'll just never know till you try. And it really just depends on how you want to treat your patients. And there's no wrong or right, which is very important for people to hear on this, right? Like just because you're not doing a wellness-based periodontal protocol or model doesn't mean that you're providing a disservice to your patients also. You're still there for them. You're accepting their insurance, which they want to use. You're providing value for that. Kudos to you, right? But if you want to choose to do things at a higher level, if you feel more empowered by it, if you feel like more satisfied by it, then moving to that model by getting a consultant and understand that you can sell patients more hygiene, even if they're insurance driven, is okay. But you have to have the right conversations with your patients. It's really important.
With your hygienists, when you guys communicate, do you guys do like an end of the day communication where we sit down and talk about the patients you guys had? Is there a time when you guys recap like who you handed off, or, you handed this person off to me and told me what was wrong with their mouth, but I found this other thing and you could have found it this way if you looked at this? Or do you coach your hygienists on like the actual, like, so we talked about like the overall relationship up here, but then down in the trenches relationship now, the operational relationship, the you and her over top of a mouth with a patient relationship, the front lines. Tell me how you think that should be optimally.
Well, we do it on a micro level and we do it on a macro level. So the micro level is same day, end of the day. If I have a patient where I was unaligned or misaligned with my hygienist during the conversation, I will tell, first of all, I'm always supporting the hygienist in the operatory.
So she's never necessarily wrong. You're always supporting her in a positive way. So it's like mom and dad. Dad never makes mom look bad. Mom never makes dad look bad. We support each other in front of the child.
You can always get away from a conversation. If she said they needed a crown and I don't feel I need a crown, I can say, you know what, Mrs. Smith, I'm going to take hygienist X's information and I'm going to re-review it again. We're going to have a conversation. And if I have a concern, there's always a conversation that you can have to back away from something if you want to, right? Without making a hygienist look like they're over treatment planning or pushing care or whatever, because you want them to have both hygiene conversations, periodontal conversations, but more importantly, oftentimes restorative conversations, right? And you want them to have it with freedom, right? Without any handcuffs. So sometimes if I'm in the hygiene room and we're going through our review together and there was something we were unaligned on, I'll tell the hygienist, Arta Taff, Arta me, the router, and it'll come back to me at the end of the day because we're in the middle of the day, so we forget things. And then I'll pull them aside at the end of the day and say, hey, I just want to review how we looked at these things together, what we could have done differently together, so that the next time we do it, this becomes a win for both of us and the patient, right? Because we know that we're going to see that patient again, and 6 months is probably not going to make or break, or 4 months or 3 months is not going to make or break their periodontal status. So next time we can be better prepared for that conversation. That's on a micro level, immediate feedback at the end of the day. On a macro level, we do monthly meetings, right? Which, not only do we morning huddles, which give us the opportunity to talk about perio status and all the things with patients and whether or not they've gone through periodontal therapy and where they are with that, and if they're waiting to do it or if they haven't agreed to it yet or whatever. But also on a monthly level, we do all the things that you're talking about, which is, hey, how do we get aligned from our diagnosis, which JP Institute teaches? How do we get aligned from our the way we look at things restoratively? When you take pictures and you see a crack, are you recommending a crown here? Why? What is the threshold? How do we get aligned with those things? So we practice and you role play and it takes effort, but those are the things that the good practices do to become aligned in their system. They make time to have open, freedom-based discussions without judgment, right? And then you can continue to grow together.
So it really comes down to being more of a team and not looking at the hygienist like they're a tool in the practice or a component, but it's more of a symbiotic relationship of us cooperatively approaching care together and as a team attacking that care with a unified look on it.
It's super critical because I want my hygienist to feel empowered to make diagnoses, but technically they can't, right? And so they can do all the data, but a doctor typically has to make a diagnosis. So we have to support them through that process, right? And education helps through that. So I always want to make sure that I can be as much in agreement or in alignment with my hygienist as possible because it leads to better outcomes. And that's all we're really interested in doing. I mean, it really is critical. It's critical, especially because we want our patients to be healthier.
So it goes back to doing what's best for the patient all the time, no matter what.
If you lead with the patient's best interest in mind, it doesn't become that complicated, right? And that's why my conversations with patients are so genuine, right? Because I can look at them and go, here's the data. You have 6s and 7s. You can either leave it and expect it to get worse, or we can intervene now. Yes, intervening means more time, more effort, more dollars. But the converse approach is more breakdown, more complications. And if you think it's going to pay a dividend long term, I've been doing it long enough, Mrs. Smith, that you're not correct. So I'm here to support you any way we can. But I want you to hear from me that I'm going to diagnose you the same way every time because those 6s and 7s aren't going to just spontaneously get better on their own. It doesn't work that way.
They're not going to vanish. They're going to get worse.
They're not. So we have to stay aligned in treatment. It's important that your hygienists stay aligned. I have 4 hygienists. They don't all work at the same time. 3 of them work at the same time, but they do share patient care. And if their notes aren't aligned and if their messages aren't aligned and they go from one hygienist who says they have periodontal disease to the next one who says they don't and they're fine, we'll see you in 6 months. That's the worst case scenario. That's a disconnect for a patient, right? Now they'll be given the hall pass when they don't deserve it, right? And so we have morning huddles that allow us to say, this patient has been diagnosed with periodontal disease. They have yet to say yes to periodontal therapy. It's important that we have the same conversation again with them, that when you're coming in, Mrs. Smith, and we're gathering the data and we're putting them up next to each other along with the x-rays, you're seeing continued deterioration because it will not spontaneously heal. I don't care how hard they work at home. They are not going to get to the base of that 7 or 8 millimeter pocket without being numb and having a professional hygienist clean that out. By the way, quick verbal skill as a gift. The key to getting patients to say yes to periodontal therapy is A, not calling it root planing and scaling. That's ridiculous.
Yes, never.
Okay.
Yeah.
That's something that we talked about when you lectured to me, and I was like, and you were like, what do you call it? And I was like, periodontal therapy. Like, stop talking. And so, not calling it periodontal therapy.
Yeah, you,
right?
you screwed up my talk train.
I did, absolutely.
You disrupted me.
So it's just very important, right? You're not calling it periodontal therapy, and you're having them understand that the more often they're being seen, the only healthier they're going to get, right? And that's really critical. It's just really critical. So I think you just have to stay on message for patients. Oh, my point was not calling it periodontal therapy and also mentioning this is a non-surgical approach to getting your mouth healthy again, right? Because as soon as you tell them that if you continue to let it deteriorate, I just want you to know you're going to move toward needing to see the specialist if you actually want to get your mouth healthy again. Oftentimes, you just have to educate them a little bit that, again, not leading through fear, but why wait for something to get so bad that you have to have a surgical approach or a laser therapy approach, which is going to be as expensive these days, when I can do it even more traditionally, but with modern techniques, non-surgical. And I'm telling you, that line, sitting someone up, always sitting them up, looking them face to face, and saying, I can offer you a non-surgical approach to getting your mouth healthy again, can pay a huge dividend.
We have to wrap up here in a second, so we're running up on time. I also teach that talk about it like it's a procedure, not a cleaning.
It's not a cleaning. It's not.
It's a procedure. It's not.
A cleaning is above the gum.
Yeah. I was just at a practice here in Tennessee. It was a client of mine. I just happened to stop by and say hi. They asked me for some advice, and I was like, stop talking about hygiene. Stop talking about SRP like it's a cleaning. Delete the word cleaning. Stop saying deep cleaning. Stop saying more thorough cleaning. This is the first procedure in your treatment plan. This is it. This is the first procedure. And it's a procedure. You're numbing them. This is not a cleaning. It's the furthest thing from a cleaning. So listen, we have to finish up here. We're coming down on time. So, but this was, we recorded a 3-part series today. This has been awesome fun. Dr. Todd Fleischman is an amazing dentist in the city of Philadelphia. We met, when I was speaking in Philadelphia. He's a great guy. I'm pretty sure we're going to bring him back more. It was a great 3 episodes. Doc, is there anything you want to say before we sign off?
Just that I appreciate you, man. I mean, this is all about opportunities. Like I told you before we got on live, that I'm here to JFL, right? Just find out. I'm not saying no to any opportunities these days. I'm only thankful for it. And I'm looking forward to being a bigger part of the Unfiltered community. I really appreciate the opportunity.
Yeah, we're going to bring you on. You're going to be a periodic guest, without a doubt. There's so many subjects we can handle together. Okay, guys, remember, like, subscribe, share. There's no paid sponsorships. This was done purely with the spirit of what's best for you guys. In the description below, there should be a link for our virtual study club. It's a WhatsApp chat. We have speakers once a month that are really awesome speakers. Sign up. They're awesome webinars. Thank you guys and have a great day.